So stomach pain can happen for a variety of reasons, one of those being ulcers. The pain from an ulcer can be beyond unbearable. So here to help us recognize the symptoms and learn about some treatment is Nurse Christina Paris from the VA. So thank you so much for joining us today.
Good morning.
Yeah, so first off, can you just tell us what is an ulcer?
So an ulcer is a sore that develops in the esophagus. So our GI tract starts at the mouth, goes all the way to the bum, and it's a very muscular organ. And what can happen is, acid and different things can build up and cause sores that actually occur inside the lining of the esophagus or somewhere in the stomach or in the intestines.
And what would people kind of look for as symptoms of an ulcer?
So typically people will start to have pain or discomfort. They'll feel it kind of in their stomach, might feel like when they're hungry, when you get hunger pains, well, you might get that even when you're not hungry. You'll get that same kind of discomfort and pain. Also, they might feel full quickly, have belching or feeling kind of bloated, have heartburn, maybe nausea, vomiting. It can be intermittent or it can last for long periods of time. Poor appetite and weight loss.
And then what can be done to treat it and kind of just, can it go away completely or does it kind of stick around?
So sometimes it can heal. In fact, most of the time it heals. The big thing is you need to find out what is causing it and treat the cause. So some of the testing that they can do to check for ulcers, they'll do what we call an upper GI, where they'll take a scope and they go down into the esophagus and they look into your stomach to see what's going on. They also can test for H. pylori, which is a bacterial infection, and that's just a simple blood test. So definitely, if you're starting to feel it, you want to go and talk to your doctor. And then there's different medications that they'll use to treat it. They'll give you proton pump inhibitors, which are like the omeprazole or Prilosec. Nexium, you'll see those kind of things. So a lot of them are over the counter, but you can talk to your doctor. Now, if you have H. pylori, they're going to want to treat that with, because it's bacterial, you can take an antibiotic for that. So they'll treat that with an antibiotic. But the big thing is finding out what the cause is. So again, stress can cause it, can build up that acid, and cortisol levels can cause inflammation in your stomach lining. Things like taking too much ibuprofen, Tylenol, any of those NSAIDs for long periods of time, those can cause, it can irritate the lining there too, or the H. pylori. So we want to find out the cause, treat the cause, and that's the best thing.
Well, thank you. I know it can be so difficult, like having stomach pain. There can be so many reasons for it, so it's definitely good to be able
to always go and see your provider, talk to them, and they'll help you kind of figure out what might be the cause or what's, what tests to do next.
It's always good to stay on top of these things.
That's right.
Just being proactive all the time.
Absolutely, absolutely.
Yes, well, thank you again so much for joining us this morning. And then coming up, we have What's Trending, including